Hi friends, welcome to anemia and polycythemia. According to World Health Organization criteria, anemia is defined as a blood hemoglobin concentration less than 13 gram per dl. So it is very clear that hemoglobin level, if it is less than 13 gram per dl, it is a anemic case. Where HCT level less than 39% in adult and HB less than 12 gram per dl and SCT less than 37% in adult female. So there is so many people get confused what is the exact count where we should consider that anemia is less than 12 or 11 or 9. It is less than 13 in males and less than 12 in females. So signs and symptoms of anemia are varied depending on the level of anemia and the time course over which it develops. Acute anemia is nearly always due to blood loss or hemolysis. Acute anemia is always because of blood loss. Acute anemia is nearly always due to blood loss or hemolysis. In acute blood loss, hypovolemia dominates. The blood pressure will decrease. That hypovolemia dominates. The clinical picture, hypotension and decreased organ perfusion are the main issues. What will happen? In clinical picture, what you will see in patient, that there will be loss of blood pressure, it will be hypotension, decreased organ perfusion are the main issue. If there is less blood pressure, always there will be less supply to organs, that is decreased organ perfusion. Symptoms associated with or chronic onset vary with age and the patient and adequacy of blood supply to critical organ. Moderate anemia is associated with fatigue, loss of stamina, breathlessness and tachycardia. Patient will come to your clinic with fatigue, थका हुआ लगता है, fatigue, loss of stamina, कुछ काम करने की इच्छा नहीं हो रही है, स्टेमिना गया हुआ है, ब्रीथलेसनेस, सांस फूलती है, एंड टैकीकार्डिया, हार्ट रेट बढ़ा हुआ मिलेगा. The patient's skin and mucous membrane may appear pale. What will happen? The skin and mucous membrane will appear pale. If the palm crease lighter in the color and the surrounding skin, finger extended, HB level is less than 8 gram per dl. In patient with coronary artery disease, yes, patient is coming to your clinic with coronary artery disease. Anginal episode may appear or increase in frequency and severity. In patients with carotid artery disease, lightheadedness and dizziness may develop. In all these patients where there is angina or coronary artery disease, they will say I am feeling dizzy, lightheadedness. A physiological approach to anemia diagnosis based on the understanding that a decrease in circulating RBC can be related to the either inadequate production or RBC or increase RBC destruction. Two things are there. Either there will be more production, but that is not, the RBCs are not in, either there will be inadequate production or increase in RBC destruction. That means there is inadequate production, means less production of RBC, and increase RBC destruction, that is loss. Within the category of inadequate production, erythropoiesis can be either infective due to erythrocyte maturation defect. Erythrocyte means RBC, erythrocytes maturation defect, which usually results in RBCs that are too small or too large. That means if there is erythrocyte maturation defect, RBC cells will be either too small or too large, or hypoproliferative, which usually results in RBCs of normal size but two or few of them. Hyperproliferative stage we have seen in that chart, that more bone marrow damage, fibrosis, aplasia, iron deficiency, stimulation, inflammation, metabolic defect, renal diseases. And there will be RBC very too small or too big. Basic evaluation include reticulocyte index, review of blood smear and RBC indices, chiefly mean corpuscular volume. The RI, reticulocyte index, is measure of RBC production. Yes, what is RI? RI is a measure of RBC production. The reticulocyte count is corrected for the ACT level and for early release of marrow reticulocyte into the circulation, which leads to an increase in the lifespan of circulating reticulocyte beyond the usual 1 day. If the anemia is associated with a low RI, RBC morphology helps distinguish a maturation disorder of from hypoproliferative marrow state. We have discussed about the hypoproliferative or maturation disorder. Maturation disorder means cytoplasmic defect, iron deficiency, thalassemia, sideroblastic anemia, nuclear defect, folate deficiency, vitamin B12 deficiency, drug toxicity, refractive anemia. So, in hypoproliferative marrow states, RBCs are generally normal in morphology, but too few are produced, very less production. Bone marrow examination is often helpful in the evaluation of anemia, but is done most frequently to diagnose hypoproliferative marrow state. Other laboratory tests indicates to evaluate, particularly from anemia, depend on the initial classification based on the pathophysiology of the defect. These are the discussed in the policy. Then next to that, we have to think about in next video